Welcome to my channel. I'm Michelle, and today I want to share with you how my 3-year-old was diagnosed with celiac disease. And I want to share this video for a couple reasons. One, my daughter's symptoms were very vague and it was difficult to have her diagnosed. And two, this is to help parents, caregivers out there who are struggling, who know there's something wrong with their kid but they can't pinpoint what it is. So let's start with symptoms. My 3-year-old. She didn't start to show any symptoms, I would say, until about 3. She never had any issues eating before that. No problem with solid food, anything like that. But something happened at 3. So I would say the first symptoms I started to notice were not your typical symptoms I think you would think about with celiac disease would be behavior and mood. She was suddenly very moody, which is difficult, you know, with a 3-year-old because the moodiness could just be being 3. But hers was different. It was like having a teenager in the house almost. Her emotions would go from one end to the other very, very quickly. Everything was upsetting her. She would cry a lot. She started crying about everything again. And she didn't do these things before. And again, it's difficult because, you know, at 3, behavior like that can start. So it wasn't just that, but that's definitely the first symptom I noticed. And if you see me looking down, it's of course because I have notes. She also got very whiny. She started whining about everything and crying. I noticed that she started to get a little more sleepy. She went from taking 1 nap a day to wanting to take 2 naps a day. But if she took 2 naps a day, she wouldn't sleep at night. She started to become disinterested in things, and it was weird because it was almost as I would describe like a depression. She just seemed kind of removed from things. And it wasn't a dramatic change. It wasn't like suddenly all this started happening at once. It was over time, subtle changes I started noticing. I would say she got what they now refer to as foggy brain. She got confused about things. Specifically, I remember when we taught her how to wash her hands when she was potty training. And she was potty trained about 2.5. She had it down, she knew what to do, but suddenly she was standing at the sink crying, and I'd ask her what's wrong. She said, I don't know. Often her responses when she was upset or crying was, I'd ask her what's wrong, and she would just say, I don't know. I don't know, but she would say she forgot how to wash her hands or she didn't know what to do. And this is something she had mastered not too long ago, so I thought that was very, like a red flag. So I did what I think all parents would do. I made an appointment with a pediatrician and I started Googling things. And when I Googled her symptoms, you know, they're so vague. So many different things came up, so that wasn't really helpful. So, of course, I took her to the pediatrician, and it was due for her 3-year-old checkup anyway, so it landed well. So, as far as her vitals, she was fine. She was petite, so I think she was only in like the 10th percentile, but that wasn't unusual for my children. I have 3 children. I have a 7-year-old, a 3-year-old, and an 11-month-old. All my children have been on the smaller side. I'm a smaller person, so the doctor wasn't seeing that as a red flag. She had gained weight from her previous appointment, her 2-year-old checkup, but I started talking to the doctor about these subtle changes I had noticed, that her behavior had, most of all the changes, I've noticed that she just became whiny and crying a lot and disinterested, and she asked if any large changes had happened in the family, and I said no. And mind you, this is in the beginning, or no, right before the pandemic started, because I took her in November, and the pandemic really started in the following February. But I was about 7 months pregnant at this point with my son, and the doctor said, you know, she could be reacting to another sibling coming, or just changes in 3-year-olds. It's typical toddler behavior to be having these tantrums. And she said that if the behavior continues to, of course, come back. And she asked me about her appetite, if she ate well, and she did. She always ate really well. She never had a problem eating. She never complained of a stomach ache. I think occasionally, maybe, no more than a typical child would. She never stopped eating. She didn't give us any really physical indications that something was going on besides her behavior. After that appointment, the moodiness and all that would continue, of course, and we thought, okay, maybe it's toddler behavior, we'll keep an eye on it. Then some physical symptoms did start to show up. She started getting a bloated stomach, and it was pretty obvious because, like I said, my daughter's petite, so it would balloon up, and it didn't do that at first. It would take about, I say, 3 months after her 3-year-old checkup that we started noticing, and it wouldn't happen all the time. I would start writing down all these things I noticed, and about once a month her stomach would kind of balloon up, and after it ballooned up, she would actually throw up. About once a month she started to throw up, and we couldn't figure out what was causing it. And when she went to the bathroom, most of the time it was normal. Occasionally she would have diarrhea, but again, no more than I would say a typical toddler. And like I said, her stomach would continue to get bigger and bigger. And then she would, one night, and it was always at night, in the middle of the night, she'd wake up and throw up, or immediately after dinner she would throw up, and then she could feel fine. And she said she felt fine. So this happened for about 3 months straight, and during this time we tried different things. This was, of course, after the pandemic had started. I had my son in February, and I would say about February, March, April was when the physical symptoms started really appearing. So she'd throw up like once a month and be completely fine and normal after that. So it was difficult, you know. We tried eliminating certain foods. I tried to eliminate dairy from her diet because my oldest daughter, my 7-year-old, and my youngest son, my 11-month-old now, both had milk, protein, soy intolerance as infants, and my daughter outgrew it. My 7-year-old outgrew it by 2. So I thought maybe, you know, dairy was bothering her because her siblings had had that issue. So we tried cutting out dairy for 2 weeks, and it didn't really make a difference. Her stomach still would, around that time, bloat, and she'd still get sick, and she'd have this bout of diarrhea, and then things would go back to normal. So we took her back to the pediatrician, and, you know, we said, this is what's going on. It's not going away. We want further testing to be done. And we really had to push the pediatrician to do more testing because, like I said, her symptoms were so vague that it could be anything. It could just be normal toddler behavior. And this is where it's important. If you as a parent notice something is different, especially since she's 3, she's at home with me. I'm a stay-at-home parent. She's at home with me all the time. I know what her normal behavior is. I know what she's like, and I know when it changed. So you as the parent, it's your job. Don't feel bad about advocating for your child. If you know there's a change, if you know something's wrong, go with your gut. And that's what my husband and I did. So she went back to the pediatrician, and we pushed for more testing to be done because something was clearly not going well in her body. So she did some blood work. She did a basic metabolic panel. She had an x-ray done to make sure there was no blockage, intestinal blockage or anything. She felt her stomach around, make sure there was no lumps or anything that felt like it shouldn't be there. And she said, okay, we'll see what the blood work says when it comes back, and we'll go from there. So like I said, she got the blood work done, and it was basic metabolic panel. She had a thyroid panel done because I have hypothyroidism, so that's genetic, autoimmune disease. And my husband has diabetes, and again, autoimmune disease, so she had her glucose tested. And her thyroid panel came back normal. And I wrote this down, so if you see me looking down, that's why. Her thyroid came normal, her glucose came back normal. Her metabolic panel had some flags on it. Her calcium was a little low, and again, all the flags were a little off. They weren't drastically off. Like I said, the calcium was a little low, so it was like a point off. Her bun creatine, I hope I'm saying that right, was high. Her ratio was high, and this can mean a couple of things. It means you're, 1, dehydrated. It means you could be having some kidney issues that could mean you're having intestinal bleeding. Her red and white blood cell count was normal. They would look specifically at different red blood cell tests, and it showed that she was slightly anemic. And again, not a large, but just a little. And the doctor said, okay, she's off in a little areas, but nothing drastically. I'm not sure what's going on. What I'm going to do is I'm going to refer you to a pediatric gastroenterologist, so a GI doctor that specializes in kids. And I said, okay, let's do that. So it took her a couple weeks to get into the GI doctor. And this was in the May, so just as the pandemic started really flaring up. So we actually had a telehealth visit with her GI doctor because they weren't seeing patients at that time. And we described the symptoms that she was having and what we had noticed. Because from 3, so she turned 3 in November, and then in May we had this appointment with her GI doctor. And he had been sent all the paperwork from the pediatrician and everything. And he asked us some questions and family history and stuff. He asked about, celiac disease, and we don't have a family history. My husband and I, no one in our family that we're aware of has celiac disease. So he wasn't at first thinking that could be it. He mentioned something called cyclic vomiting syndrome, where sometimes kids just throw up and they're not sure why. He asked about migraines, if she experienced those, because sometimes kids can get migraines, throw up. She never had that problem. She never complained about her head hurting. So he said, okay, well, what I'm going to do is I'm going to do my own blood work, and we're going to look for some specific things. And what he ended up looking at was her specific iron levels, because that wasn't tested before. They did some basic blood work in her metabolic panel, but it wasn't specifically iron. So he wanted to test her iron. He wanted to give her the celiac test to look for the antibodies for the celiac disease, and a basic allergy test, so peanuts, milks, things like that, to see if she reacted to anything. And it was just a blood test, it wasn't the prick test. So she went in, got that done, and then a couple days later I got the call from the GI doctor. And I want to mention that he was specific, a pediatric GI doctor, so he only worked with kids, which I really appreciate because she was 3 and so young, so we needed someone that really specialized in that. And he said her blood work came back, and her antibody levels for the celiac disease were very high. And just to give you an idea what that is, for the celiac test, they test the antibodies in your blood. And again, I'm not a doctor, I'm just a parent trying to explain this to you. So, consult your doctor, consult professionals if you have questions. But a normal level is negative in the antibody celiac test would be a 0 to 3. A 4 to 10 would be a weak positive, so they may be gluten sensitive or they may have issues with it. And anything greater than a 10 would be a positive, that they have celiac disease, that they can't tolerate any gluten. Her test came back as 100, so clearly she can't tolerate gluten in any form, and she clearly had celiac disease. And the doctor said she tested positive. And he said, what we want to do right now is we want to have her come in for an upper GI. And that's where they stick the tube down your throat and look at your intestines, because they can look at the lining of your intestines and the little villi, and if they're raised and doing their normal thing, then you're fine. But if they're flat, compressed like that, then celiac disease. They're not working right. Your body's not getting the nutrients it needs to do. And he said he wanted to see what her intestines, how much damage had been done, because her levels were pretty high. And I said, okay. And because of her age, she would have to be sedated for the procedure, which was difficult because at this point I had a newborn, and because of COVID restrictions, only one parent was allowed to be present at the time, and I couldn't bring my newborn son with me, so unfortunately my husband had to go, and I had to stay home with my baby, which was difficult for both of us. But she went in, and one reason we really wanted to have, the only reason they would give us a definite diagnosis of celiac disease is if her upper GI showed the damage to the intestines. and we wanted for future school, because we do public school, to be able to put, yes, she has a definite diagnosis of celiac disease. So we went with the upper GI, quick procedure. I think it took like 5 minutes. Doctor was wonderful. My daughter really enjoys her doctor. And he, of course, came back to the room right away, told my husband, yep, pictures look like she definitely has no celiac. There's no question about it. He noted that the intestines, there was some damage, but not extensive. We had definitely caught it in more of the beginning parts of it. And he said, we will have an appointment set up with a dietitian to talk about where you go from here, you know, diet-wise. We said, okay. And we went home and we got ready. We talked to the dietitian, and, you know, she explained the things that you can and can't have and what to avoid. We also talked about whether our household would go gluten-free, because there's a larger risk of cross-contamination with gluten, because it can be on anything. If you touch a piece of bread that has gluten in it and then you touch a handle, that handle now has gluten in it. So if my daughter touched it and then ate her food or touched her mouth, she would essentially be putting gluten in it. So as a family, we decided to go gluten-free, which was not easy, especially for my 7-year-old. My 3-year-old, it didn't really faze her much, the change of food, because she was so young, but my 7-year-old knows what mac and cheese should taste like. She knows what bread normally tastes like. And that'll be a separate video about how we helps with that transition. But yeah, that was pretty much the story. And the emphasis I want to have here is she didn't have a lot of physical symptoms until the end. And luckily the doctor said, her GI doctor said, we caught it in a time frame where it didn't impact her growth yet. She hadn't seen growth restrictions, which is one of the telltale signs that celiac children have. They don't really catch it until they notice, oh, they're not growing the way they're supposed to, which is sad, because we want to get it before it impacts things like that. Like I said, her blood work came back as a little off, but not drastically. But she had that blood work done, I think, in February. No, she had it done in March originally with her pediatrician, and it was a little off. And by the time he drew her blood in May, the end of May, she was pretty anemic. So just in that couple month time frame, a drastic change was going on within her body. And she's 3. She needs all those nutrients to grow and to do the things that she needs to do. So if we can catch this early, it's better. And fortunately, like I said, the pediatrician wasn't convinced it was necessarily something that bad until the symptoms started getting worse. And I think it's extremely difficult to diagnose a young child around 3, because they can't tell you a lot. You know, like I said, she never really mentioned her stomach hurt. But to her, I think that was just the way you're supposed to feel. She didn't really know anything different. She didn't really put, oh, if I eat this piece of bread or if I have this sandwich, my stomach hurts, maybe it was the sandwich. She doesn't know that. And I think she just got used to her tummy feeling that way, so she never knew it felt differently or what it felt like not to have your stomach hurt. So it's difficult. And as a parent, it's difficult. And as a doctor, it's difficult. So if this video can help anybody out there, then that's the point, you know. She was diagnosed in May, and she's doing much better. She saw an almost immediate change, but again, I will update videos on that as well. I'll do some more videos on, you know, what we eat as a family, what I feed my 3-year-old celiac child and my 7-year-old and my 11-month-old, and just the journey of how difficult it can be and how overwhelming it can be, especially as a parent, and how we navigate family members and grocery shopping. So that's the beginning. That's the story. So I hope to make more videos for you guys. I hope this is helpful for some of you out there. And again, if you ever have questions about your child's health, don't be afraid to push. Don't be afraid to find another doctor. Don't be afraid to find a second opinion, because you know what's best. You know what's different. You're the parent. Thanks, guys.